Good evening, and thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. Over 8,000 COVID-19 patients are currently isolating at home, according to the latest statement released by the Ministry of Health. That's in the last 24 hours. We also have about 1,000 patients who are receiving treatment in different healthcare facilities, 86 under the ICU. With all these numbers, with our curve still not flat, because according to the World Health Organization, we have to achieve a 5% and below positivity rate before we could say that we have a flat curve. So why are the healthcare workers downing their tools in the middle of a pandemic? We speak all that with our guest tonight. Next to me is Boniface Mutembei, who is a COVID-19 survivor. Thank you so much for your time and for agreeing to be part of the Family Matters show tonight. Thank you. And also we have Seth Panyako. Seth Panyako tested positive for COVID-19 as well, but there's something more interesting that the healthcare workers want to down their tools in the middle of a pandemic. 9 months on, still negotiations, and there is no agreement between the unions, especially the cadres, the health cadres, and the national government. We'll also be talking about that. Thank you once again, Seth, for coming. It's not your first time here on Family Matters, but thank you once again for being here.
Thank you.
All right, so let me start with surviving COVID-19 story. There are so many people watching. Right now, we know someone who's tested positive for COVID-19. Many Kenyans are aware of this virus. They either have been infected, because we have 8,000 people who are positive and are at home, or we have family members who are infected with COVID-19. Boniface, when did you test positive for COVID-19? Did you go to a testing facility while you traveling, or is it symptoms that you began to exhibit?
Thank you so much, Purity, for having me here tonight. It's a great pleasure to be here tonight to speak about this journey that is so worrying to many, because in the beginning, I personally did not believe there was COVID until I tested it, because I remember it was on 5th. That is when I began my symptoms.
5th of which month?
Of September. Oh. That's when I began the symptoms. The whole day I attended a wedding on a Saturday. Sunday was okay. Sunday I was okay. On Monday, the whole day in the morning, I started feeling, really feeling tired. I was feeling some cold. I lost appetite the whole day, and I decided at the place of my work, I decided to take a rest. And one of my colleagues came and asked me, why are you asleep at this moment? And I told them I'm not feeling well because I have a headache. So the journey had to start there, but little did I know that I was appearing, or I was heading to the channel of COVID-19, because I remember the same day I called a colleague of mine who is in another region, and once we spoke over the phone. We earned funds, and I told him that udisikia corona wapi? Whom have you seen
it's
with
you
the
now
corona? Yes, I'm
you.
the one.
Okay.
Little did I know I'm already infected. So
now that you did not believe there was COVID-19 and you have these symptoms, did you think it could have been this virus?
No, I didn't know, unless because I had contracted from a colleague. A colleague, we met on that during the day. She told me she needed to go and take a COVID test, and I told her, "You are just joking. Can you keep off from here?" So she went for a test, and on Wednesday, the results were out. And during that time, I saw on our WhatsApp group being posted that she had tested positive, and I was in a meeting, so I got worried. And still, bearing in mind, I had the symptoms. After the news broke, I just called one of the profession who is very close to me, Dr. Catherine Mudhuri. I informed her and I told her what I had experienced. She tried to cool me down. And let me say that
that's now when your
yes,
when your colleague tested positive,
yes, and
you began to agree with the fact that there is COVID-19 disease.
Yes.
Okay, hold it there. We'll be talking about your test and then what next. So Seth, while I was in isolation, you encouraged me and told me you are not in this alone because I'm also in isolation. So when did you test positive for COVID-19, and is it because you are a frontline worker, or maybe can you tell how you contracted the disease?
Yeah, I think I tested positive on 2nd of November, and I think that was about after like 3 days or 4 days of contracting the infection, because I'll feel the symptoms and I knew I was positive. So by the time I was going to hospital for the test, I even was joking around. I was telling my guys, you know, you just do it formality, but the truth is I know I'm positive. So I tested, and fortunately within a period of 24 hours results were out. They were positive. I did self-quarantine. We had a meeting on 23rd of October in Isiolo, but I don't think I contracted the infection there, because I came back, went home. I went home, and I had my brother and my sisters and my family in Kakamega. And when I came back, I think I contracted the infection when I came back to Nairobi. I think one of the employees in the office contracted the infection. I don't know whether it's from the people we serve, because we serve frontline health workers, who are the nurses, and we come in contact with them on a daily basis. So an employee caught it, and it passed on my driver passed it on to me. In the entire office, I only had 2 fellows who didn't test positive. And I'm still not sure why it happened like that, because my secretary that I spend much of the day with working, because we work so closely, even when we are amending the letters, we are writing, sometimes we are just talking, because I'll call her to stand behind me, because even when I make corrections, she'll still go and make some mistakes. So I tell her, look here, let us do it like this. Is it making sense? Then we agree. Then she goes to do the letter. She tested negative twice. The first test she did in a different hospital, I disputed. I took her to another one, she tested negative. Then one of my employees also tested negative. So I don't know how that happened. I don't understand. But at the end of the day, I think I was not worried about it, because the only place that really worried me was one, and I don't think my family knew it. I was very much worried about my 2 brothers that I came in contact with. Though I'm saying when I went home, I was not having it, because my 2 brothers have underlying medical conditions which I did not want them to contract this infection. Personally, I believe my health is perfect. I have no any medical and underlying conditions. I do practice almost every day, 3 days in a week. And I've been doing very, very well in terms of health-wise. So I was not very much worried about the infection, actually. In fact, if you go to where I went to test, you talk to those lab people, they'll say, this guy came here laughing and he was telling us that he knows he's positive. So when I tested, I went back home and I told my family, I think we need to take precautions even as we wait for the results, because definitely we are positive. That's how it was. And we stayed in the house. We had a lot of support from our friends. So
was there another family member who tested positive?
My wife tested positive, actually. Only 2 in the family that tested positive.
Okay.
Everybody else did not test positive. It's very interesting. This infection seems not to be attacking children. They remain strong, they play around, they don't get it. And even when you look at the statistics across the world, it shows clearly that this infection does not really affect children as opposed to adults, and especially those who have underlying medical conditions. And that's why I was very much worried about my 2 brothers. I was stable myself, but in my mind I was saying, if my 2 brothers can get this thing, I'll be in trouble.
Then as a nurse, and from what you've been able to gather about this COVID-19, because you mentioned that it's a bit confusing that your secretary tested negative and you had worked very closely that week. Same case with me, because for me, the people that I had spent an entire weekend with both tested negative, you know. And again, it's interesting that you both can trace how you contracted the disease. For me, I cannot, because when I was testing positive, there was nobody at KBC who was in isolation who tested positive, you know, for this disease. So from the little knowledge, the knowledge that you have as a nurse, why do we have in some cases that our very close contacts that we might be 100% sure that I infected this person with COVID-19, they end up turning negative for this virus?
You know, the COVID-19 virus is still new, and the studies are still being conducted on how it's behaving. There are so many things that are coming up now. We are being told, for example, today, if I contract the infection today, after a period of 10 days, I will not be able to pass it over to somebody else. Why it's not when I was at home, I was closely sitting next to somebody who had COVID-19. He went and tested later on that he turned to COVID-19, but I didn't get it from him. I came here and I had no symptoms. I went for the meetings, I came back, and I was going with my life until one of my employees was hospitalized, was put on oxygen, and the COVID results were not coming out clearly in a public hospital. We were forced to transfer her to a private hospital, and she was admitted for pneumonia, and then later on she tested positive. She was very sick. But then that's when I said, now since she has tested positive, immediately the first thing we did was close the office and ordered everyone to take the test. So how and why your friends may not get it has many factors. First of all, you know, this is a viral infection which really sends us on the immune system. And maybe your colleagues maybe could be having a strong immunity. We do not understand. Maybe they have already developed their own immunity because of childhood exposure to similar infections. Back in the village, my old mamas in the village tell me that, you know, this thing has been there even during our time, only that the name is different. They'll call it, I don't know how I can say it in English, but in my mother tongue they'll say okuyeko kukari. This is the big infection that comes through the mouth, and the mouth will swell and what, and you'll cough, and they say it used to be there, and we'll use traditional medicine and we will heal. And I told them, fine, if you want to give me traditional medicine, I will take. And I was given medicine, and I was taking 2 spoons in the morning, 3 times a day. They do that prescription. But you see, I do not understand how it works personally, because if my secretary didn't get it, I cannot explain how. Maybe she got it earlier than us. We don't know. We don't know. Maybe she got it earlier. She walked through the journey. But basically, it requires that this is a viral infection. It therefore requires that everybody must work toward ensuring that your immune is strong. You eat well, you practice, maintain good body hygiene, what we call the 8 rules of basic good living, basic healthy living. So when you maintain that, and even if it gets you, you'll walk through the way I did walk through, and I succeeded. But I know the first 5 days are the most difficult ones. Yeah. That is when the symptoms are there. That's when you are feeling a lot of pain. Yeah. You feel like someone is beating you up. You don't want to eat, just want to. So first 5 days are very difficult days. But the reasons why it gets to one and leaves other friends away that you are close to, I cannot explain.
Okay. Boniface, let's quickly take us through the journey after your colleague testing positive, and initially you didn't understand why people are talking about COVID-19 because according to you it never existed, and now your colleague is positive for COVID-19 and you have some of these symptoms that you had health officials mention. So what took you to the testing center, and then just tell us what happened until now you decided to take the test, and then after that how you received the news that you are positive.
Thank you so much once again. As I earlier said that after the news broke, I felt so discouraged. I became very weak. I remember that night I did not take anything.
So how did you, when did you test immediately?
I tested the following day. And after I tested, the results came on Saturday. It took long, because it's the period that now people had begun the infection and really ran very fast. So I received the news on a Sunday afternoon at around 2. I remember I was in a meeting and I saw the phone ring. I did not bother. After a few minutes, I saw it is MOH, and I felt discouraged. I did not pick the call. They called again and I told them, call me after 10 minutes. They told give us the exact time to call you. They called me after 3 minutes. So once they told me that tested positive, they just asked me if I have somebody within me, and bearing in mind I stay alone, and I told them I have somebody who will take care of me. And the one who spoke to me told me, you are courageous about this thing. I told them I expected this because I had contact with a person who was infected, and our health was very weak.
But deep down in your heart, you are not well. So what was going through your mind that now it's time, I'm going to die? You know, what are you thinking?
Actually, that's the first thing that came in my mind. Bearing coming from my shacks, and I decided how that journey would be if I died, because I knew somebody in the village who had died of COVID on Saturday. And I saw this is an deadly disease that I did not believe. But I thank God and my health is quite okay. I don't have any problem of health issues. So I just called my doctor again and informed her I've received the news. And she told me, you need to stay alone and isolate. I stayed for 21 days alone. I know I have a neighbor who is very friendly, and he tried to call me throughout. But what I did not have to check on him. I only told him that I am on Zoom meeting, so I can't see him. And he kept on ringing my phone. Sometimes I avoided, because I remember there is a day I received my parent called me because she got rumor. And I told her I'm okay, because I know with her health it could actually bring some issues to her. So during that period of isolation, that period is not easy, because when you're alone, it's really you feel lonely. Once you break the news to your friends, they know that now you start experiencing stigma, because I know there is a friend called me several times on the day.
There. They tell us about the stigma. So before we talk about the nurses' issues, because we cannot end this show, you are about to go on strike. I don't know whether nurses are going on strike, but at least we know the clinical officers are beginning their strike. Quickly comment on how you are, I know you are self-isolating, just how you are taking care of yourself, whether you had any symptoms and whether you are under any medication.
I told you earlier that the first 5 days are the most trying days. The symptoms are really there. You have no taste, you are weak, you want to sleep most of the time, you don't want to eat, the body is you have a lot of pain in the body, like somebody has beaten you. When you cough for a short call, you have a lot of pain with the entire body. I'm telling you the truth. If you went through this, you know it. And these are signs and symptoms that we must talk about it, because there's nothing going about it. So I was not on any medication, only save for food supplements. And luckily for me, I normally have take antihistamine in the evening, so I was taking celestamine. Then sometimes I started taking prednisolone. But I have been taking celestamide for some time. Then I went to the chemist and was given some nutritional supplements, vitamin C and these antioxidants, and I was taking them, those zinc and those things. They are very expensive actually for common Mwananchi to afford them. But for us that we are able to get them, we took the entire family actually. The isolation that I did with my wife was not the isolation like the one he did. I was around with the rest of my family in my house. We will eat, we will sleep, we will walk around. My daughter will always be with me, because if I can't even try to sleep, she'll come and slap me. Around the bedroom, she'll follow me and slap me and tell me come back to the sitting room. So the isolation we did was our family against the external world. But for ourselves as a family, we were together throughout. My children never caught it. I have about many children in my house. I stay with many children that I support, and my own, and so we're about 10 people in that house. And it's out of the 10 people, only 2 of us had it. And we are now okay.
But you are putting on the mask in the house. And
Which mask in the house? There was no mask in the house. The mask is at the gate. How do you put on mask in the house? My daughter will come to kiss me the first thing I enter the house. And so the only thing we did was that we didn't allow any visitors.
yeah.
And up to now, we have not yet allowed visitors to our house. Even my brother stays around next to me and he has not come to my house. He's still scared. I told him, continue staying until the day will have the courage. So the truth is that COVID-19 is a reality, it's a killer disease. We just need to continue eating very well, to practice. If you realize you have COVID-19, don't think it's a death sentence. Mainly viral infections are self-limiting, but the problem is if they get you when your immune is challenged, they can wipe you out on this as very fast. Or they can cause a lot of injury if you're infected by a virus and your immunity is compromised. And that's why when you see the large number of those who have passed on have got underlying medical conditions. Some of them have HIV/AIDS, HIV not necessarily AIDS. Some of them have cancer, some of them have hypertension, diabetes, and you find that the immune is normally compromised when you have those underlying medical conditions. But all viral infections, apart from AIDS or HIV, are self-limiting, like COVID-19. After 10 days, you can't infect anybody. And after maybe 14 days, the disease is gone.
Yeah.
So basically, it was fun staying in the house with my family, and we are 2 of us are sick, and the rest, life is going on as usual, no masks in the house, but nobody leaves the gate, not even the gate, nobody leaves the door of the house to the outside world without putting on a mask.
Yeah.
And we will not allow anybody, even my neighbors' children, like coming to my house, we put a pandego there, positive, don't come to this house.
So your neighbors knew that...
They knew that we were sick.
This family, you know...
We're sick. I didn't want to endanger my neighbors because I love them so much. We stay together as family, and therefore if you're sick, the first thing we need to do is to alert your neighbors. Here, iko shida. Don't come to this house. We are sick. Give us time until we'll tell you we are now okay. Yeah.
Now, with the background and with the experience of COVID-19, and you've said the first 5 days, of course, they are very tough. We have 86 patients who are in ICU and over 1,000 receiving treatment. And the pandemic is still here with us. A nurse is going on strike, before I ask you this next question or not. A nurse is going on strike.
The strike is beginning today.
Okay.
Tomorrow, which is 1 minute past midnight, because nothing has changed. I cannot preside over the death of my colleagues who cannot even meet their medical expenses. Today, I have participated in fundraising for a nurse who died in Busia. He died at Life Care Hospital in Bungoma, and the bill was 2.3 million. We have raised, I don't know how much we managed to raise today, because the raising of that money had, we had a deficit of 700,000 by yesterday. So I do not know whether what we did today, we have been able to complete that bill. We cannot preside over that. We are not even having surety that there will be any compensation of the families that are left behind, because some of these families, nurses are the only breadwinners in their families, and when they die, they leave nobody behind to take care of the family they have left behind. Some of them are living very young families, and that's why we are saying without group life insurance, the strike is on. Without comprehensive medical insurance, the strike is on. Without paying us a reasonable risk allowance. Today we are being paid a risk allowance of 3,850, and a 30 supplement of 30 days cost of folic for vitamin C, for example, will cost you 5,000 shillings. And we're giving 3,800 shillings. When they tax that subject to 30%, what are you left with? It means you have to go back to the little that you are saving from your salary to buy these supplements. And all health workers, from where I sit, they are supposed to be on this supplement throughout, so that the immunity can be boosted. They must eat better. You know, they must ensure they have balanced diet. They have fruit and they have food which is biased in fruit and vegetables. And you know, vegetarian foods are very expensive. So when you add nutritional supplements, you find that it's very expensive to maintain a health worker nutritionally, for him to be his immunity to be strong enough for him to fight the infection if it comes to attack him. But we have a government that doesn't care. We are not going to allow our nurses to continue dying, and no one cares about these nurses.
Would you give us the latest statistics of nurses, or let's say healthcare workers if you have, but in particular nurses who've been infected with the virus and who have died? And to combine that question, would you say that lack of protection of nurses is a bigger contributor to the higher infection rate among the healthcare workers? Because at one point the CS said that nurses or healthcare workers are Kenyans as well, and they could get the infections out there, not necessarily in line of duty.
You know, there's some careless talk from some quarters of the government, which myself as a leader, I normally do not mince my words to tell them off. Our CS is on record having disputed the vaccine that was discovered in America, and that was very wrong coming from our CS. The way he's taking it lightly, how this infection is affecting health workers, is what is really angering health workers. There are only 2 employers within public sector that have proven they have proper management skills and ability to protect health workers. For example, I'll freely tell you that Kenyatta National Hospital has impressed me on what it has. I used to work in the Kenyatta National Hospital. I know we used to have group life insurance at that time, and it is still there up to now. They have comprehensive medical cover for all employees and their dependents. They have basically put mechanisms in place to ensure that health workers are protected to reasonable level. The same applies to Moi Teaching and Referral Hospital, but Moi Teaching and Referral Hospital is the best in Kenya in terms of management. The board of Moi Teaching and Referral Hospital, if you read them, they'll be #1 in Kenya. They'll always be #1 because they have a wonderful CEO, they have a wonderful board, they have made the hospital look like a family. So it's a responsibility of everybody to ensure that you do the right thing. Moi Teaching and Referral Hospital does not have a single nurse who's on contract. From 2017 up to now, we have never had a single strike at MTRH because we have a CBA in place. All issues being raised in Moi referral, the CEO takes very fast, tries to handle them. For example, the issue of risk allowance. He has already done a letter to SRC asking SRC to allow for him to look for money to pay 30,000 shillings to the nurses in terms of risk allowance. Everybody agrees that we deserve even better than 30,000 shillings. You ask a question, why is it that the nurses are highly affected? We are getting the infection from maybe
at home
or places where you drink. I want to tell you that I cannot rule out that one, but the percentage will be very small. Nurses are highly infected because, #1, they are the first frontline health workers. They spend a lot of time with the patients. They spend 24/7 with the patients. That caring of the patient, a nurse will hand over to another, a nurse will hand over to another nurse. There's no single time where the nurse is not seeing the patient. #2, the nurse carries out procedures with the patients many times than any other person. For example, our colleagues, some of them will come and see a patient and write notes and go away. But a nurse will go, take vital signs, give medication, take specimens, and this is time you're spending, the number of time you spend with the patient, the number of procedures you're carrying with the patient exposes you to infection. Then the nurses also are exposed to all other health workers. Because if you are a lab technician, you come to take a sample, you will meet a nurse. You are a physiotherapist, you are coming to do physiotherapy, you meet a nurse.
So how many have been infected so far?
Those who have been infected, about nurses, the last report I had was about 1,500. But in terms of death, we have reached 24 nurses, if you add the one who died in Busia the other day. So you can see that out of the nurses, the health workers who have died, about now headed to 40, 24 are nurses. That should clearly show you that the nurses are the highly vulnerable to infection because of their nature of work and the number of hours they take with the patient, the number of procedures they carry with the patient, and the type of people that interact with. Because even the relatives, when they come to the hospital, they interact with the nurses. When the doctors come to review the patient, they interact with the nurses. Clinical officers interact with nurses. Even the administrator of the hospitals, when they come to the ward, they interact with the nurses. So we are highly vulnerable. And this research has proven, even COVID-19 has actually proven this. But when it comes now to remuneration, we are now at the back.
All right. I'll be getting back to you. And I'll definitely ask you what happens to over the 88,000 Kenyans who've tested positive for COVID-19. Boniface, I haven't forgotten stigma. You said that the few friends that you had informed about your condition, it didn't turn out too well because you experienced some stigma. Maybe you can tell us more about that.
Thank you. As I had earlier said, is that this disease has a lot of stigma, and you feel it even inside yourself, because in this situation, once that friend of mine called me and I told them I had contracted COVID-19, he just disconnected the call. But what I know,
maybe it was like an issue with the airtime.
No,
I had a similar experience. I can help him. I had a similar experience.
Tell him.
And he will laugh. And I'll tell you who the person was, but not the name.
No, don't
one of the
say
governors.
name. Okay.
I'll not tell you the name of the governor.
Yeah. What happened?
One of the governors called me and told me, Seth, how are you? I said, I'm fine. I think there's a problem the county nurses want to go on strike. Then he told me, I'm here in Nairobi, I want to see you. I told him, oh, you know, I am under quarantine. I have COVID-19. He disconnected and disappeared. He never talked to me again, up to now.
Okay.
So I can see if people are charged the responsibility of protecting us, are thinking that when they speak with you on phone, they'll get the infection.
Exactly.
Then you can see where we are.
Exactly.
Let him continue to this.
So once he disconnected the call, I just felt it inside me now. I felt really this is an undeadly disease. But after he disconnected his call, I really thank my boss Caroline, who has been there for me, because after he disconnected, it is like she had connected, she called me, and we spoke for half an hour. She has been an encouraging person, because even after COVID, she received me in the office very well. And let me say, even after you walked out, even you yourself, Purity, you can say after you came here, maybe some were trying to move far away from you, because even at
I came here when
workplace.
almost everybody has left, so I haven't experienced anything.
Sure.
But here, we've had several colleagues test positive and they haven't experienced such a thing. But I can resonate with you, because for me, someone called me and I was like, hope you did not infect me with the virus. You know, it's such an insensitive way to speak to COVID-19 patients. Maybe if you have anybody who is positive, it could even be shock to the people that you're breaking the news to. So we cannot really blame them. But again, as Seth had said, the first 5 days are a bit tough. So if someone lives alone like him, it's always good to check out them, because they're not even eating at this time. They are not even eating. Okay.
Sure, because after that period, I went back to the office. It took like a few days before they took it that now I'm COVID-free. It took days, and then everything normalized. But what is there is that people need to know that COVID is real. There is stigma, and you feel so lonely. But I want to thank this group is that medics are really the front line of this, because I know I have, as I said earlier, I have Dr. Catherine, who kept on calling me, and many others, and these are the people should be really, their health should be concerned about, because they are the really majority who are interacting with these people. Because during a period when I saw you had contracted, I saw maybe you might be worried, but I needed to encourage to tell this is it is real, but you can heal very fast depending on your health. And the other thing is that we need, as we are being told that let us keep social distance, let us sanitize. All this is not, we are not being told this because we want to impress someone. It is for your safety. You need to take the right precautions and for you to be safe from this disease. The other thing that I may say that young people don't still believe that COVID is real, because after I got out of the market, I just went interacting with the people. I attended a wedding after a week, and in the wedding, somebody told me, "Are you a COVID person that you are staying with a mask throughout?" I told them, once you realize is the when if you realize that COVID is real is when you know.
I think we need to have this conversation once again, because time is not on our side. And Seth, I really want to ask you, many Kenyans, there was a question actually to you by Abel, and is asking, what is the union doing to protect healthcare workers during this time? answer that question with this one. What happens to the over 88,000 positive patients right now when you down tools beginning midnight?
The question you're asking should have been asked to the government. Because I am not going to allow my colleagues to expose themselves to infections when they are not provided with personal protective equipment. Okay. We must have, you cannot take an army to go and fight when you have not provided them with the weapons to go and fight. When the army goes to fight, like when we released our army to go to Somalia during Linda Inji operations, they were having some compensation mechanism back at home. Here is an army, the health workers army that was frontline fighting COVID-19, and they are being told there's no medical cover. I've just told you we have done a contribution today for one of my colleagues who passed on in Busia. And you're told that when you die, there is no any form of compensation for the families that are left behind. And you are told you continue earning these peanuts that you can't do anything with them. So what we are saying is that the question on how the union is protecting nurses, that's why we are saying go out on strike beginning tomorrow, 12:01 a.m. tonight, to ensure that your rights are respected. That is the only role the union is supposed to play. The union is supposed to provide leadership and guidance, and that's exactly what we are doing. It is upon the members. For example, when we talk about contract nurses, we have nurses that have been employed by the government on contract, dubious contract that do not reflect the provision of the law and the national employment policy. You are paying a nurse 15,000 shillings. As such a nurse, if he fell sick, how is he going to get the money to pay the medical bills? I have a nurse currently admitted at ICU Kakamega General Hospital. She works in Bungoma. Her salary is 25,000 shillings gross. When they deduct, she gets around 20,000 shillings. Her bills, I'm sure, and I'm praying very much that she fights and goes through and she heals, might be even 2 million shillings or 3 or 5 million shillings. Where will she get this money? She has no community medical cover. She's underpaid. So we want all the nurses on contract to be paid their salary, and that salary must be in conformity with the work of equal value for equal remuneration. So they must be paid like those nurses who are on permanent and pensionable, and they must be converted to permanent and pensionable. We have BSN's interns. They have worked for 3 months, no payment. We have these nurses on contract called UHC, now 7 months, no salary. We have in Vihika, nurses have worked for now 15 months, no salary. And yet you are telling us to continue working when we cannot even pay rent for where we are staying. We can't even buy food. Even those supplements they are talking about, it's not possible for these nurses on contract.
All right. We have to wind up. I hope you're going to be open to any talks if the government calls for any and end this strike. We definitely, I'm sure you understand it's going to have some devastating impact on the already fragile healthcare system. Thank you so much, Seth, for your time. Thank you so much for your story. We need to talk about this some other time, especially on the awareness. People are not aware on how to care for COVID patients, especially those under the home-based care program. But thank you, Boniface, for coming to our show.
Thank you.
I promise you, Muhika, I'm winding up in 30 seconds. Allow me to read one or two comments. Kevin Ndambiri is saying it is about fighting this disease. Then the priorities of healthcare workers should be observed to keep them safe in fighting this pandemic. We have Kenya Nito, you're saying you're tuned into Family Matters. And then Sasuke, what problems did you encounter during that period you were infected with COVID-19? I think he has talked about what the challenges that he went through. Even Seth has talked about what he went through. And then there's a lot of feedback coming in, but we have to wind up because we are out of time. Thank you once again for your company. Thank you for watching Family Matters tonight.